Good evening, everyone. Thank you all for being here. We are so happy that you're here to celebrate this landmark achievement that's been years in the making. Substantial completion of the Enloe Health Gonzales Comprehensive Cancer Center. I'm Jolene Francis, Vice President, Chief Development Officer, and I am so excited to celebrate you and the critical role that you have played in making this audacious vision a reality. This is your legacy. And I'm speaking to every single person in the room. This is your legacy. And I truly hope that you are deeply proud of what you have helped accomplish. Because of you, thousands of patients will have access to more timely, advanced cancer care close to home, reducing the need for travel and improving treatment outcomes across our region. But more about that later. First, a few introductions. Joining the celebration are other members of the Enloe's senior administrative team, a few of whom you will hear from tonight. We also welcome the Enloe Health Board of Trustees, chaired by Mr. Rick Krapelka, and the Enloe Health Foundation Board of Directors, chaired by Mrs. Audrey Tennis. And I'd like all of you to please stand, or if you're already standing, raise your hands so we can thank and acknowledge you for all of your work. We're also honored to welcome the hardworking volunteers of the Comprehensive Cancer Center Capital Campaign Committee, led by our dynamic tri-chairs, Bill Carrier, Sierra Grossman, and Judy Sitton. And I'm really not supposed to say this, but I'm going to. Today is Judy's 80th birthday. My favorite lady, happy birthday, sweet Judy. The entire committee list has been scrolling through the screen, and I'll ask all of them to either stand or raise their hand where they are so that we can acknowledge them and thank them for their extraordinary work during this multi-year campaign. All the committee chairs and committee, thank you so much. In just 3 years, this team helped drive the most successful capital campaign in Enloe's history. Not only did you meet and then exceed the fundraising goals that we aspired to, even when we kept raising the bar, you did it with passion and grace and humor, a lot of coffee, and a ton of really, really hard work. And we can never, ever thank you enough for your dedication to this critically important project. Thank you for taking my call and saying yes. But of course, the real reason that we are here this evening is to celebrate our generous philanthropic supporters and the legacy of hope and healing that you have helped create for thousands of families across our region. All of you understood the need and the priority to build a home for expanded state-of-the-art cancer treatment and critically beneficial supportive therapies and services in the counties with the highest rates of cancer and cancer mortalities in California. You understood the vision and you made it your own. More than 1,300 individuals, families, and businesses made charitable gifts to this campaign. And of those, 500 were first-time donors to Enloe, demonstrating unprecedented engagement in our mission. And I'm sure that I won't adequately express the level of what that level of engagement means to all of us at Enloe and how thankful we are for the trust that you place in us. We are all very, very thankful indeed. And no matter the size of the gift, it was significant to you, and therefore it was very significant to us, and we are very grateful. But you have invested more than your dollars in this project. You have invested your hopes and your dreams and your hearts into making this center a reality. Our patients and their families will not only see your name on a donor wall, they are going to feel your compassion, your encouragement, and your love infused in every single inch of this beautiful space. Together, our community's committed more than $21 million in cash to help build this exceptional facility and fund ongoing supportive therapies that are so critical to patients and families fighting cancer. Together, with an extraordinary gift from the Gonzales family, there's more than $34 million in philanthropic support in this new facility invested in this project. Imagine that, $34 million. Thank you for helping us bring this vision to life. Thank you for trusting us, for always standing with us, and for holding our patients in your hearts as they receive care in this special place. I hope you will always be proud of your life-changing legacy. And now it's my pleasure to introduce another member of Enloe's senior team to share the behind-the-scenes story of the project's history and the work undertaken by a talented group of partners that brought our vision to life. While many of us had our hands, and maybe even our feet, in this project for several years, he has had his entire self steeped in it from the very beginning. It's not an exaggeration to say that this project would not be what it is and where it is without him. Please welcome Enloe's Chief Financial Officer, Kevin Woodward.
Thank you. I was given 8 minutes to fill. I don't mind public speaking, but it's not the thing I'm best at. So I was told tonight that Winston Churchill read his speeches. I think they were just telling me a fib to make me feel good about this. So, anyway, good evening, and thank you for being here as we celebrate the completion of the Gonzales Regional Cancer Center and Enloe Health. This project has been incredibly meaningful to me. I hope I don't lose it because we talked about this a little bit. And tonight I was asked to walk you through the journey of how we planned, developed, and executed the incredible building we see before us. Today is a meaningful milestone for Enloe, for the patients and families we serve, and for Northern California. The center represents years of vision, planning, partnership, and belief in what is possible when a community comes together around a shared purpose. Tonight we want to share how this project moved from early planning in 2020 through financing in 2022, groundbreaking in April of 24, construction and implementation, and ultimately the completed project we celebrate today. Our goal was simple but ambitious: to build a state-of-the-art facility and to strengthen Enloe's cancer program so that across our region, our community can receive comprehensive leading cancer care close to home. The journey began in September 2020 with a strategic planning process focused on the future of cancer care in our region. In 2021, Enloe completed feasibility and programming work to better understand the community need, future volume, clinical requirements, space needs, and the best way to organize cancer services for the patients. What became clear was both the need and the opportunity. Northern California has thousands of new cancer cases each year, and those patients deserve access to comprehensive, coordinated care without having to travel. With the vision and growth trajectory defined, the effort transitioned to building the business case to support a significant capital investment. In other words, the work and work product expected by our board of trustees, our community, and our donors to support this project. This phase integrated volume projections, staffing models, and facility requirements with detailed financial analysis. The analysis reinforced a critical principle that guided the project moving forward. The success of the project will not only depend on the facility itself, but on Enloe's ability to execute broader programmatic change, expanding clinical capabilities, strengthening physician alignment, and improving the coordination of care. Once that vision was clear, the work became much more detailed. In July of 2021, we moved from strategy into facility planning and the project team conducted stakeholder interviews, site tours, and structured visioning sessions. Multidisciplinary user groups were convened to define how services should function at a granular level, including patient flow, staffing models, departmental relationships, key adjacencies, space requirements, clinical adjacencies, operational needs, equipment planning, and many details that would determine how this cancer center would function every day. The work served as a critical bridge between high-level strategy and physical design. It ensured that the facility would be sized appropriately based on the projected need, enable efficient workflows, and strong coordination, and incorporate flexibility to adapt to future changes in cancer care delivery. In parallel, conceptual planning translated these requirements into block plans, stacking diagrams, and site concepts, providing a tangible representation of how the future cancer center would operate and integrate with Enloe's broader healthcare system. That work ultimately shaped a facility remarkable in scope, approximately 109,000 square feet, with total building and equipment cost of $154 million. The project grew beyond the original assumptions of both size and capital need, but that growth was tied directly to the program requirements, the long-term vision for cancer care, and Enloe's commitment to building a center that would meet the needs of our region well into the future. As the project moved forward in late 2021, Enloe selected highly specialized design, construction, planning, legal, financial, project management partners to bring this vision to life. This was not a traditional project built in isolation. Enloe used a collaborative project delivery model, a structured project management approach designed to bring key stakeholders together early and often, support shared decision-making, identify issues before they became barriers, and keep the project aligned around the scope, budget, schedule, and purpose. That model was one of the defining features of this effort. Stakeholders, planners, designers, builders, equipment planners, finance leaders, and Enloe leadership stayed engaged throughout the process. The model created a forum for disciplined review of design decisions, cost implications, operational impacts, and construction sequencing. It also helped the team address challenges early, evaluate trade-offs thoughtfully, and remain focused on creating a center worthy of the community it would serve. The project delivery model and contracting relationship put key parties at financial risk. A risk pool was created with incentives tied to keep the project milestones and cost targets. That disciplined approach mattered. It supported governance, accountability, and transparency throughout the life of the project. It helped the team manage scope, monitor costs, maintain alignment with the approved capital plan, continue moving forward through complex planning, construction equipment, and financing challenges. Planning also extended beyond the walls of the building. Nearly $40 million of the total project cost was dedicated to equipment and furnishings. This included clinical equipment, information technology systems, support, furniture, fixtures, and other investments necessary to support both advanced care and create a welcoming and functional environment for our patients and families, physicians, and staff. The financing of this project was also a significant undertaking. In November of 2022, Enloe completed a complex bond financing of nearly $400 million during one of the most volatile financial markets in recent history. That transaction required significant preparation, coordination with financial advisors, legal counsel, underwriters, auditors, and Enloe leadership team, and it helped secure the capital needed to move this project forward. Throughout 2023, 24, and 25, the team continued to manage against the approved budget and timeline, remaining focused on delivering the facility as responsibly as possible. This is an important part of the story. This center reflects not only the vision and generosity, but also careful planning, disciplined project management, and strong stewardship of the resources entrusted to us. And now standing here today, we can see the result of that work. The Gonzales Regional Cancer Center is more than a new facility. It's a promise to our community. Patients facing cancer should have access to coordinated, compassionate, high-quality care close to home. that families should feel supported, and that our region deserves a cancer program built for the future. Although today is most importantly a donor recognition event, I would like to briefly acknowledge several of the organizations and individuals whose technical expertise, professional guidance, and partnerships helped this project possible. Foley and Lardner, Enloe's legal counsel, Oric, Harrington and Sutcliffe, our bond counsel, Kaufman Hall, financial advisors related to the transaction, Kane Brothers, the underwriter in the selling of our bonds, Moss Adams, our auditor, ECG consultants, most importantly, the facility planning work was instrumental in this project. And then the true warriors of this project, Covalis, our construction management firm, HGA, our architect and designers, and Swinnerton, our general contractor. To our donors, partners, physicians, staff, board members, leaders, and community supporters, thank you. Your commitment helped turn a vision into a place of healing. It's my honor to celebrate this milestone with you and to welcome the opening of the Gonzales Regional Cancer Center at Enloe Health. Thank you. Now I have the honor to introduce the Chief of the Warriors, Enloe Health's President and Chief Executive Officer, Mike Wortman.
All right, we see Jolene come up here with a heartfelt talk, Kevin with his heartfelt talk, and I thought, I got to keep it together. Kevin's work on this cannot be overstated. I just want y'all to know, and you can tell by the complexity of the problem, all that went into it. If it wasn't for the talk that he had to give today, I think you'd all notice that he's visibly relieved. Now that we're getting to the point where we're going to open the building. So Jolene gave me the same 5 minutes. Well, actually, she only gave me 5 minutes. So I had to write my talk, but apparently I didn't put it in big enough font to read in the slides, so I'm going to have to wing it a little bit. The first thing I'd like to do is thank Jolene Francis. She and her team did a super job, and I'd like to join her in thanking Bill, Judy, and Sierra Grossman for the work that they did. It was in the campaign committee. There's a lot of great people on that committee, including my wife, Kelly, who I'm going to shout out because I'm her husband. We still have a ways to go to prepare this campus for its first patient. This will largely be the job of our operating team, Julie Martin, Tracy Hunt, Aaron Hawkins, Susan Hawes, and a host of others, including Dr. Sam Maj and the medical staff. It'll be a ton of work. But with the growth we've experienced over the last 10 years, we have a lot of practice getting state licensure. And I'm sure all will go as expected. But this isn't, as Kevin said, about operations. It's about you and what you've brought to our community. As you take your tours, I think the beauty and functionality of this building is going to speak for itself. But more than a legacy building, you've brought the infrastructure necessary for us to build on a foundation of cancer treatment that was established a long time ago. It's just interesting, the legacies we have in our community. Individual at Booth came to me and showed me some old brochures from the Enloe Follies that some of you will remember. And man, a lot of the same last names that we have here today. But this is going to address, as Jolene said, the #1 public health issue in our area and probably in our era. And that's cancer and cancer-related illnesses. Your investment in the future health of our community is already getting the attention of health policy experts who are looking to us to bring state-of-the-art technology and treatment to a broad expanse of rural California. Services that would otherwise be unavailable locally. No small influence has been the Aaron Rodgers Foundation and our commitment to supportive care services that very few cancer treatment centers provide. Our thanks to Jeff Kregel, who's here today representing the Aaron Rodgers Foundation. Thank you, Jeff. So could we have built this building without your help? Absolutely not. Absolutely not. Your generosity and your example made this project happen. And while I'd like to call out each and every one of you for your support, there are two people in particular whose gift we would not be standing on this particular location, and that is Dan and Dawn Gonzales. Jolene asked me to share a little history of the Gonzales gift of land. There's not much to tell, really. A few years ago, Dan asked me if we could use the land. I said yes. That's pretty much all there was to it. What I can say, without question, is that it was a gift of the heart. There was no 100-page contract replete with terms and conditions, no financial histrionics. The gift wasn't limited to what we absolutely needed for the cancer center, as you can tell by the rest of the land out here to the west. And this donation was made just when Marion Park was taking off. I want you to think about that for a minute and the value of the land, not only the market value, but the return on investment with property that's adequately managed. That could have gone on forever. But none of that mattered to Dan and Dawn. They saw an opportunity to help, and they did. And in doing so, they didn't even think about the naming opportunity that they might have for their family's legacy. We kind of had to twist their arms a little bit to get them to put their name on the building. And why they chose to do that is really an indication of the kind of people they are. I hope they'll share that story with us. So it's with deep appreciation and my honor to introduce Dan and Dawn Gonzales.
I'm a little older than you are. Can't see the crowd. First I'll see the crowd, then I'll see my paper. Just want to take a look around. Wow. I've always considered myself a visionary, and I don't think I saw this one coming, I have to admit. So it's very humbling, super exciting, of course. You can imagine, like, what would you say if you were up here, right? Just think about that for 1 minute. So good afternoon, and thank you, Mike, for your words. I'm honored to stand here today with you, the key donors and supporters, to celebrate this milestone. I'm not here as an individual entity. I'm not here representing my family. I'm here representing a community. And everybody chipped in and made this happen. And as everybody has said, this just doesn't happen without that. So I thank you. We all thank you. Dawn and my donation of this land provided the place. But what I see here before me and what you see is just something much, much greater. I've always knew this was going to be a special piece of land. And I had trouble visualizing like what it would be, like big hotels, big retail centers, but nothing ever came to me. And when I'll say the stars aligned, everything kind of happens for a reason. I'm a big believer. It kind of came to me, and I sent Mike a text. Hey, Mike, can you meet? And he says, sure. And I'm like, are you still building the cancer center? He said, yeah. I'm like, okay, let's meet. And it was, we met like 2 days later on a kind of wet seats outside in our terrace. his nice pants got wet and I got wet and we scratched the deal out and it was wet. But I think, as Mike puts it, it was an epiphany by me, and I would say it was, and we've never looked back. I've never looked back. I must admit, it's difficult to stand here as an individual and accept this kind of a recognition when there's so many people. We all know there's so many people responsible for where we're at. But you know, my name's on the building, so here I am. So the naming of the building, Mike, as the Enloe Gonzales Regional Cancer Center. When I explained to Mike and Jolene at the meeting of why I felt compelled to select a surname for the center, they both immediately supported it, like both unilaterally immediately supported it. I explained it was not only just a recognition of our Spanish heritage, but even more, I wanted to represent a sense of hope that all things are possible. And I feel that way. When I saw it up there, I'm like, holy shit, you know, like anything's possible. And I want people to walk in that front door, and when they look around and they see the spaciousness of it, and they're sick and they're not feeling well, to feel like there's a sense of hope here, of caring and quality health care. So I've also found out after the fact that this will be, as far as my research can tell, the first Spanish surnamed cancer center in the United States. And it's in Chico. We should be proud of that. I'd like to reflect on a few people who have made this gift possible. First, to my wife. And as Mike said, because she's my wife, just kidding. And he was kidding too. My steadfast partner for 43 years. We've been married since we were 19 years old, 20 years old, sorry. And she knows that, and my family knows, and those who know us know that this doesn't happen without her steadfast support. We invited our children here today. We have 4, 3 were able to make it. I'm happy you're able to make it and witness this amazing community endeavor. Nobody knows our story better than you do, as you're a part of it. So it's fitting that you share this. My oldest brother and his wife of almost 50 years are here to represent our large family, 8 brothers and sisters. Both of our families, both Dawn and I come from large families. And it's the strength and the confidence that they've given us over the years to accomplish what we've accomplished. When I think about how Dawn and I have gotten here, I can't help to think about, have to throw this in here, because the company we built together, Fifth Son, at the end we had 450 employees, and I just don't stand here today without the efforts of those people. They should take great pride. If you know them who've worked for us, they should take great pride in this contribution, because it doesn't happen without them. Mike Wiltermuth, our history goes back about 6 years or so, and I've always been impressed by your spirit and your willingness to get things done and your entrepreneurial spirit. If you want to run Barber Yard after you retire, Kelly, I'm sorry, but every time we met, wrong paragraph. We both know, and anybody here that runs companies or is a leader in one sense or another knows that a leader is only successful when they earn the trust of others and the belief of others, as you did, Mike. In fact, the major reason why we made this donation is because I trusted you. You said you were going to build this cancer center for the community, and you never faltered. With your support staff, you made this happen. Jolene, you talked about legacy, and this is truly your legacy as well. So thank you very much for the community. Jolene, thank you for your tireless efforts and for being such an incredible ambassador of Enloe and this project. Every time we met, your passion and enthusiasm kept me going and kept many people going. It's hard to ignore that. And thank you especially when every time I texted you that had cold feet about the naming of the cancer center, you ignored me. Like last time was like a month ago, literally. She just flat out ignored me. Dr. Maj. Yeah. And to your entire staff, on behalf of the many patients you have cared for, behalf of my friends close to me personally, thank you for your compassion, your empathy, your commitment. I'm sure you hear these words often. You must. But I hope you know this, and I want you to know this, that you inspire others to give of themselves. And sometimes, because of that inspiration, a cancer center gets built. Our hope is that Enloe Regional Cancer Center will represent what is good about this community and the hope that anything is possible. So thanks for all of you coming here. It's truly amazing. Try not to let your jaws drop because there'll be cameras out there. But look up in the ceiling when you get there. You're going to feel better. So thanks for all your contribution.
Well, those are hard things to follow, but we're going to try. Right now, I'd like to invite Audrey Tennis to the stage, along with our CEO, Mike Wiltermuth, and our CFO, Kevin Woodward, and Dr. Sam Maj, Director of Cancer Services at the new Gonzales Comprehensive Cancer Center. And we're going to present the big fat check that represents all of the love and commitment that you have put into this project. Gentlemen, on behalf of the Enloe Health Foundation, our board of directors, and all of our wonderful, wonderful supporters across our region, we present you with $21 million for the new Gonzales Comprehensive Cancer Center. All right. Well, thank you so much. And now I'd like to welcome Jamie Holmes. Jamie is one of our very dedicated spiritual support volunteers at Enloe Health, and she's going to offer a blessing for the building and the patients that we will care for.
Please join me in dedicating this building. In the name of the Creator and Giver of life, may this building be blessed. May suffering bodies be healed here and broken spirits restored. May these halls witness the frequent and jubilant ringing of the milestone bell, announcing that longed-for treatment goals have been met yet again. We ask for blessings for each donor whose generosity made this cancer center and everything in it possible. Their contributions are a testimony of their compassion for others. We thank you for the ways these donors have been open-hearted and open-handed, knowing their charity reaches many, many lives. We ask for blessings on our medical staff. May they triumph over cancer cells. When weary, may our staff receive stamina when they need it most. Help them rediscover what brought them into this vocation in the first place. And when disheartened, give them re-energizing moments of good old belly laughter. We ask for blessings on each person who has been and will be involved in this place in any capacity, from the employees who keep the rooms spotless, to the board members who carry out Enloe's vision, to the administrators who implement vital decisions. May they know their labor and leadership are appreciated by the communities they serve. We ask for blessings too on the many, many volunteers who share their kind-heartedness with patients and families in need. May they experience steadfast joy and gratitude during their thousands of hours of service. And with grateful hearts, we ask that every patient, every family member, and every friend who comes through these doors receives grace. May those who yearn for answers to why this, why now, why me, find peace, whether it's in the knowing or the not knowing. May every patient be granted resilience that surprises and increases. May each small, brave step feel sufficient, especially when overwhelmed with sickness, with fear, or anger. And may the loneliness of cancer be relieved by selfless people who are more eager to listen than to lecture. Ultimately, we ask that all our patients be sustained with renewable courage, profound hope, and peace that passes our understanding. Merciful One, we come to you asking these things in both humility and boldness, trusting in your unchanging gift of love. So, as people gathered here tonight, because all of our lives have been touched by cancer, we dedicate the Enloe Health Gonzales Comprehensive Cancer Center together. So be it. Amen.
All right, who's anxious to see the building? Before we cut the ribbon and tour the new center, I'm looking for something here. Here we go. Just want to pause and raise a glass to all of you, our loyal supporters and friends. We honor you and we thank you from the bottom of our hearts. Cheers. Ooh, that was good. That's one.